I'm Brendan Gormley and I run the Disasters Emergency Committee here in London. The DEC runs the national appeal in times of major tragedy overseas on behalf of 13 of the UK's leading international charities. We coordinate the fundraising with the main broadcasters, the banks, the post office, and we do it when three criteria are met: when there is evidence of substantial unmet need, when we know that the leading charities like Save the Children, Oxfam, World Vision, Christian Aid are there and able to do something in a timely and effective manner, and thirdly, when we realise that the UK public have seen something on their television or have heard something on the radio and want to respond. So when that happens, instead of the major charities going public in buying advertisement or whatever, we manage the appeal on their behalf. Success is a difficult word. What we have learnt is that it's always the poor, the marginal people, who are worse affected by disasters. So you've got two levels of success. You've got life-saving work that at least the survivors are put in safe and reasonable conditions and hopefully in a position to improve their lot. But that's not really good enough. Success also should be not returning them to those marginal flatlands. So it's in tsunami, you had those poor fisher folk living on the seashore who lost their lives and livelihoods. In Haiti, you've got people squatting on those mountainsides around Port-au-Prince, and it's the mudslides, it's their shanty towns that are washed away or collapse into the ravine. So success is trying to find a solution for them to be more secure, to be more protected over the long term. These are complicated messages, but the initial thing is to be able to say to donors, your money has made a real difference. We have been able to save and give sustenance to those that have survived, but we want to leave them in a better position than they were before the tragedy. Haiti has been the biggest thing I have confronted, and I mean that seriously, that tsunami was spread over 6-7 countries. Haiti, we saw a capital city wiped out. I don't think since Lisbon in the 1700s have we had a nation decapitated. Not only was the government affected, the UN, that is the main body charged with coordinating the international response, their building and their leadership was killed. And from my colleagues, because the DEC supports the charities and civil society, they were there, they'd been in Haiti for years, but they lost staff members, they lost offices, they lost mothers and fathers of our own staff. So not only was it a huge tragedy, but the normal infrastructure that you rely on was not there. The airport, the tower, the runway, all was gone, the port was gone. And what we're seeing now is a heroic effort to try and get people into some sort of secure emergency or temporary shelter, but you've got to clear the rubble. There they are on the hillsides around Port-au-Prince. Where is the space to try and get reasonable shelter? And while doing that, you have to get clean water, you have to get latrines, you have to get the basics, food in, while trying to get the rubble out. So it's been a huge, huge challenge. Things are working, the government is getting on top of it, and hopefully we'll see over the weeks and months to come things, some of the problems being overcome, resolved. I think one of the big improvements that I've seen over the last 5 years has been this real commitment to greater coordination. There has been an effort led by the UN system, but much supported by the Red Cross, by the charities. Save the Children works on coordinating child work with UNICEF, safe spaces. Oxfam helps on the water and sanitation, the Red Cross are on shelter. So there's what's called the cluster system, where the UN, the host government and civil society come together to make sure that places aren't, families, communities aren't being ignored, that the aid is going to those that need it in a reasonably coordinated manner. But as you can imagine, trying to get the balance right between attending coordination meetings, getting the decision making right, against the urgency of getting those supplies, food, clean water, out to the population is always a tension, and we could always do better, but I do think we have made huge improvements in coordination. There are really two models where you have reasonable government in that country. It is clearly their responsibility to manage the response, to take the lead. But I've worked in Somalia, I've worked in countries where you've got to accept that there really isn't a legitimate or strong state that can take that lead. In that case, it falls to the United Nations system under the UN OCHA, which is the humanitarian office, to pull together, make the bigger decisions, orchestrate some of the fundraising, and make sure the different actors are clear with what they have to do. What has been so important over the last 5 or so years has been the ability in real time now to put the assessments that are done by the different actors or the local communities into real-time maps that can make it possible for the proper decisions to be taken, so that there aren't gaps, or gaps can be identified where there is overlapping investment that can be sorted out. So I have seen for my teams a real improvement in the whole assessment and delivery of aid because of the new tools of GPS positioning and map making. At the end of the day, one's got to be honest and say that it is resources that is the big issue. Where you have got an international response that is commensurate with the scale of the tragedy, then there really is an opportunity, in Bill Clinton's phrase, to build back better. So first, resources. Secondly, it's the time scale. What we need is, after that life-saving period, getting people into reasonably safe and secure environment, reasonable health and nutrition. The question is then taking the long view. That then means solving problems about land tenure, solving problems about design of earthquake-resistant buildings. That's the 3, sometimes 5 years slog, let's be honest, and it needs the political will, it needs engagement. And what works against that is that the world is a troubled place, and the international community and the media often move on, and that commitment right through to the end sometimes is not demonstrated. But I think what we have learnt is that, given that it's the poor who always suffer, it is that, in our jargon, disaster risk reduction, it is prevention, it is mitigation, that is the real better investment, getting those communities ready and strengthened to face future shocks is where, again, some of the real commitment is needed. We have learnt, and it's taken us a while, that the survivors have to be at the centre of the emergency response. Little by little, we've realised that yes, we're skillful, yes, we've got resources that need to be shipped in or bought locally, but if you don't make the families, the communities, right at the centre of both your assessments, talking to them right at the beginning, getting them involved in choosing solutions. So we've got this real dilemma in Haiti. There might be a bit of space if you moved everybody 20, 30, 40 miles from Port-au-Prince and put them in the fields in tents. But the communities want to be near where there is work. They want to be near where their possessions are. And you need to listen to them, because otherwise you'll build, and I saw it in India in the last big earthquake. people built new villages and settlements, but people left them abandoned and moved back and rebuilt on the rubble of their old houses. You've got to understand about protection. Women won't want to go to your latrines 500 yards away in a dark corner of a refugee camp. You've got to make it safe. You've got to understand what their concerns are. So your question is absolutely right. They should be, the survivors, the families, are the people who ought to and know best to drive the relief operations, and then some of the longer term decision making. I think that we have been slow in realising, just as we were talking about coordination, that it needs to be the UN, it needs to be civil society, it needs to be a host government. I think we've been slow in seeing the opportunities of working with the private sector. There have been some big advances in logistics, pre-positioning, using some of the skills in logistics. I seem to remember that in Katerina, although aid wasn't getting through, DHL were getting parcels through to people in the stadium. So that's a clear and easy win. There are some real opportunities, I think, in shelter, in the medical field. But experimentation, trying to get new solutions to problems, again, is something I think that the private sector can bring. Historically, I think there's been a bit of a mistrust between the ethos and values of the private sector and the voluntary sector, but I think over the last 2 or 3 years that has certainly eroded, if at least, and I've seen really good examples of collaborative work. I think, given as I'm a fundraiser, I think where perhaps we still have quite a way to go is actually leveraging the resources, both human and financial, from the private sector. I think they could play a much stronger role, and we would welcome that. The tsunami, I think one of the shocks was that because it was the tsunami, the wave that caused the damage, everybody thought that that was the major problem. And so being clear about what are the risks that the community face, it turned out, of course, that it was earthquakes, not the tsunami, that was the issue. And so we learnt to listen to people, to do a proper risk assessment, and then secondly, to take our time. Yes, you've got to get people safe. Yes, you've got to give them reasonable emergency or temporary solutions. But to get permanent, better solutions, building back better, which is always our aim, you need to take time, because the world is a complicated place. You need to line up legal land rights, ownership, properly earthquake-resistant designs. You have to decide between renters, squatters, owners, who is going to be in the driving seat. So that the second big lesson was taking the right time to do it. I think the third is, which runs through all of this, is getting the skills of the local community, the insights of the local community, making sure that you've assessed what skills are there, are you actually using them, and then sometimes making sure that you do actually have professional help, because some of the solutions, both in livelihoods and in construction, are very dependent on professional judgment and skills. For the DEC, improvement, yes, we are a fundraising operation, but successful fundraising is based on being able to tell people who have given that we are learning and improving. So learning is absolutely the central to our monitoring. We ask our members to share with us lessons learnt. We put it into performance management. We make sure that staff and partners on the ground are properly inducted with lessons from previous emergencies. And the DEC pulls together lessons, as we've done for tsunami, on construction, or for the disaster risk reduction. So we're in a privileged place to try and pull together lessons, but we take it very seriously that our members, if they're going to benefit from public money, that they have to demonstrate that thing behaviour performance is improving over time. And it is not just the DEC agencies, it is their partners and the communities on the ground who need to have access to this information. And one of the wonderful things with modern technology, with the internet, with mobile phones, there is a much better way of engaging and making sure these lessons are available in a user-friendly and timely manner. For me, it is turning the resilience that we make available for the people of San Francisco, or even the improvements in Chile so that you had a much lower death rate with a big earthquake, available for all the marginal and poor communities that are at risk in an ever more troubled and dangerous world.